Begin. If we're going to consider science as orthogonal to whatever the public is doing, it's just going to worsen polarization, he said. We'll just continue to talk past each other. In talking to patients, he notes an important difference between saying that there's no proof that gluten has health effects in the general population and saying that there is proof that gluten has no health effects in the general population. To a concerned patient, that distinction can be huge. I talked with someone one morning recently in the hours before he started scoping, as he put it, or performing endoscopies and colonoscopies, looking through a fiber optic tube at the parts of us most of us never see. There he has come to understand that celiac disease and the effects of gluten are still largely mysterious. The textbook take on celiac disease is still that it's an autoimmune condition. It is usually diagnosed by testing for antibodies called tissue transglutaminase and by taking a biopsy of a person's small intestine after the person has eaten gluten. If a person has celiac disease, then he expects to see that the finger-like villi of the intestinal wall have been obliterated, flattened like a mowed lawn. But sometimes things get strange. Some of the people he sees who have severe atrophy of their intestinal villi eat gluten and feel totally fine. It's only when they stop eating gluten and then are exposed to it at some later point that symptoms arise. He and the rest of the celiac team at Columbia also see many, many cases of the inverse. People with normal-looking bowel walls who feel horrible when they eat gluten. Why is gluten making people without celiac disease ill? He asks rhetorically. And why is there such variability in symptoms among people with celiac disease when they eat gluten?